Hello, this is Superintendent Walt Griffin, and I want to welcome each of you back to a most unusual school year, 2020-2021. In all of my years in education, I cannot recall such a challenging time in history. There is so much going on with so many moving parts that today I just want to focus on the most critical piece, your health and safety, and what we have done to protect you. First and foremost, I want you to know that we were issued an emergency order back in July. We have followed that emergency order to the T. And in order for us to offer remote options for our families through an innovation plan, we had to offer face-to-face education for any family that wants it. So our plan, in order to receive the funding for remote education, clearly states that any family who requests face-to-face education 5 days a week in Seminole County will receive it. As all of you know, we recently had registration, and our face-to-face numbers are a little over 40% of our families opting for their students to come back to school. Now that number is a little misleading because in that number, we also included families that did not respond. So we're working very, very closely with those families to get those numbers just about right. But I think at the end of the day, we're going to wind up with about 40% of our students back in our schools. I think it's very important that all of you know that we have worked and continue to work very, very closely with the Seminole County Department of Health. We have sought guidance from Nemours, Advent Health, and South Seminole Hospital. We continue to follow CDC guidelines and guidelines from the American Academy of Pediatrics to establish sanitizing and safety protocols to the extent possible. I think you need to know we have purchased 291,000 face masks, 5,000 face shields, 25,000 desk shields, 900,000 gloves, 5,700 hand sanitizers, 160 pair of safety glasses. Listen to this, 1,455-gallon drums of disinfectant solution. And probably most important to you are 135 hospital misters that will be used to mist your rooms every day. We have greatly increased our training and our training protocols and our standards across the entire district. I want you to know that I'll be recommending to the board that masks be worn at all times when students and employees cannot be socially distanced inside any of our school buildings. I've had several questions why we only pushed the school year back 1 week. And the answer is simple. If we would have gone any further, any date beyond August 17th, I would have had to delay payroll the exact same amount of time. It's important to me that each and every one of you receive your paychecks when you were planning to receive your paychecks. I think it's important for all of you to know we had a large reopening task force that did a great job and still continues to support us. Please take the opportunity to look at the Seminole County reopening plan. Lots of details and lots of your questions can be answered just by looking at that. Just a reminder that each year the school board purchases an employee assistance plan for you to utilize. There are many free services that are available to you. Please take a look in the Insider to see how to access and utilize the Employee Assistance Program. Right, over the next several weeks, you'll be getting a lot of assistance from my team, including teaching and learning, to make sure that you have the resources that you need to be successful. I want to remind everybody that our schedulers are working diligently, building very, very complex master schedules. Please be patient with them and with your school administrators as they put together schedules in this ever-changing environment. I've told everybody, if you watched any of the media interviews, this will be a bumpy start for Seminole County Public Schools because we have a lot of changes that will be happening that first week of school. We can do this together, we're going to do it the right way, and we're going to do it the safe way. Everybody have a great pre-planning week. Thank you.